Our first guest today is somebody we've had on Daytime on a fairly regular basis, and he knows a lot about marijuana, knows a lot about the laws, and in case of today's show, we're going to be talking about a clinic that he's just opened in London, but we also want to just talk about the state of marijuana laws in the country. So welcome back to Dr. Mike Hart. How are you today?
I'm good. Thank you so much for having me back on. Always a pleasure.
Well, thank you. Last time you were here, you didn't have the clinic open, and we didn't have the government moving forward on marijuana legalization legislation. Both of those things have happened since you were last here. Let's talk about the clinic first of all. How does that? Where is it, and how does it operate?
Sure. So we just opened up January 24th. It's ready to go clinic. It's on 642 Richmond Street, so right in the heart of Richmond Row. And it's a family physician clinic, but we do focus mostly on cannabis. So we provide cannabis consultations free of charge. And then after the patient sees me or another physician in the clinic, then they are consulted by a GrowWise cannabis educator. Mm-hmm. So a GrowWise cannabis educator is someone who has experience counseling someone on medical cannabis education, and that's provided to our patients complimentary after a session with me.
Presumably, most people don't have much education in terms of cannabis as a medical treatment.
Yes, there's a broad spectrum of education in cannabis within the medical community, and also in terms of the patient community as well. So we have some patients who are exceptionally knowledgeable in cannabis that come in, and they don't require much education at all. But then we have a lot of patients that do require a lot of education, particularly new patients. We find that most patients today, they have no interest in getting high or experiencing any type of euphoric effect from cannabis. They mostly are just in the clinic to get medical relief from their pain or from their condition. So when you have a patient like that, you're going to have to provide much more education than to someone who has been using cannabis, say, successfully for years before. So we do emphasize education in our clinic, and we try to teach our patients about all the cannabinoids. So we know quite a bit about THC. The general population knows that that's associated with getting high and producing a euphoric effect. However, CBD or cannabidiol is another cannabinoid that's in cannabis, and we do provide a lot of education about cannabidiol because cannabidiol is really the cannabinoid that we're using more in the clinic now, and that can be used for a variety of different conditions.
I think a lot of people would be surprised even to hear that there is a distinction, that marijuana in and of itself doesn't necessarily make you high.
Yes, and that makes treating patients very, very complicated because just coming back to the CBD, otherwise known as cannabidiol. So that can be used for a variety of different conditions, and as you've just stated, it doesn't get you high. So it doesn't act directly on the CB1 or CB2 receptors like THC does. So it provides a different mechanism of action. And we treat patients who have seizure disorders, we treat patients who have anxiety disorders, and we treat patients who have post-traumatic stress disorders and other ailments as well.
How long have you been involved in this field now, and where did you get your own education?
So I've been practicing medicine for about 4 years. I've been practicing cannabinoid medicine or cannabis medicine for about 3 years. The education that I've received has been going to various conferences. I actually just attended a conference in Toronto last week on Thursday and Friday, and just through reading online and doing a lot of self-education. So unfortunately, that's still part of the issue, is that there's no cannabis education in the medical curriculum, and that's really left a lot of physicians in the dark, because there is a belief that a lot of physicians don't want to prescribe cannabis or don't believe in it, and I do believe that those physicians do exist. However, I think there's a larger portion of of physicians who want to prescribe cannabis and would like to know more about it, but we just don't have the medical education out there yet.
Yeah. So in a sense, you're being shunned by a good chunk of the medical community.
I think I'm maybe shunned by some, but I think others do appreciate the work that I do, and I think they appreciate that if they don't have, or sorry, if they have someone that they feel would benefit from medical cannabis, I can provide them perhaps with a little bit of education about that.
And it's becoming increasingly accepted. If it's not in the curriculum, at least it's being accepted by more and more people in the medical community.
I agree. Yeah, absolutely. I think more and more physicians are starting to look into it, and the stigma is starting to decrease.
Okay. Tell me again about the location and how people can get in touch, and then in the next segment we'll just talk about the state of marijuana in this country.
Sure. Okay, so I'm at 642 Richmond Street in London, Ontario. So it's in Richmond Row, right across from Mongolian Grill. And if you want to get in touch with us, you can go to my website, which is mikehartmd.com. And you can also go to the clinic's website, which is readytogoclinic.com. And the telephone number for the clinic is 226-700-9739.
Okay, perfect. We're going to take a little break, and when we come back, we're going to talk because, as you know, the legislation to legalize marijuana in this country is now underway, and we'll talk about what that means with Dr. Mike Hart when we continue. Stay with us. And we're back with Dr. Mike Hart, who is a cannabis activist and not an activist, he's an advocate for cannabis, and he's also the founder of the Ready to Go Clinic, which we talked about in the first segment. I did want to talk to Dr. Hart while he was here about where we are in this country in terms of our acceptance of marijuana and in terms of legalizing the product, and we've taken a significant step in that direction in the last month or so. I think a lot of people were starting to think, what's the holdup? This was part of the campaign platform for Justin Trudeau, and then nothing seemed to be happening. Now I guess the wheels are turning.
Yeah, it does look like the wheels are turning. It's a good day to discuss it because I saw an article from CBC today saying that even though he had originally put the date at July 1st of 2018 as a tentative date, that they're looking to move that date up a little bit. So, maybe sometime late in 2017 or maybe sometime, a little bit earlier in 2018. But it does look like legalization is coming to Canada.
Yeah, and it's always interesting wherever it happens, and there have been several states in the United States that have gone down that road and had varying success, I guess. It's certainly a success in terms of tax revenue.
Yes.
But there's a lot of discussion about how Canada is going to do it as though it's never been done before. And there's so many templates now that you could draw from, I suppose, if you wanted to.
Yes, so they're definitely having a lot of difficulty right now sorting that out. I think that they probably won't move to like local mom and pop shop like dispensaries. It looks like it's going to be government controlled, so something that you'll see like an LCBO, but it'll be for marijuana instead. Yeah. I don't think that the government is going to not kind of cash in on the tax revenue that they can get from cannabis.
That would be one of the incentives to get it happening before July 1st, because every month you don't do it, it's millions of dollars in revenue that you're foregoing.
Yes, and we've seen that, as you brought up earlier, in some of the states in the United States, such as Colorado. I mean, they've had huge tax revenue, and I think that Canada has kind of looked at that and seen that model work in terms of bringing back more revenue. So they're going to want to do that in Canada for sure.
Your specialty, of course, is the medical side, and we spoke about that in the first segment, but you're certainly educated when it comes to this substance. Mm-hmm. Do you think you could be of use, as a consultant, or do you expect that politicians might be coming to you?
Perhaps. I mean, maybe not now, because I think they've already established something called the Canadian Task Force, and I know that there's other physicians on it. I have a friend, Dr. Mark Ware. He's on that task force. So, I would be happy to consult with the team if they did ask me, but I haven't been asked yet. And I think that we do have a great team already established, and I'm sure that they'll make good decisions.
Well, you talked about the importance of educating patients in the work you do, but in terms of educating the public about something which is pretty dramatic. I mean, there's nothing mm-hmm. new about people smoking marijuana or using edibles or whatever form it takes, but there's a good chunk of our society that wants nothing to do with this and may or may not have some misconceptions about it.
Yeah, I think some misconceptions definitely still exist. The reefer madness videos that were created 30 or 40 years ago. Some people kind of still have that stigma, unfortunately. To get rid of that stigma, legalization, I think, will definitely improve that. But to touch on your point, we really need to provide more education to the public, and we need to provide education not only to consumers of cannabis or potential consumers of cannabis, but also to the rest of the public who are not looking to use cannabis, because these people should know that they are going to benefit from the tax revenues. And we've seen in other countries, such as Portugal, for example, who's decriminalized all drugs, that this will ultimately lead to less crime. So if you are a non-user of cannabis, legalization can definitely still benefit you through decreased crime and increased tax revenue. So hopefully these things will help decrease the overall stigma.
I guess the other concern is keeping it out of the hands of younger people.
Yes, so we are going to have to be very careful with that. I'm not sure what the Canadian Task Force is doing with regards to edibles, and perhaps edibles will only be sold in lower quantities in the dispensaries, or whatever we're calling these new establishments that's going to sell marijuana. But we definitely need to be careful of that and make sure that it's out of the hands of children, because high THC in a child can certainly cause some harm. And what we want to do is we want to make sure that cannabis is used and it's respected as a medicine, and that it's not abused recreationally.
2 quick points, and we're quickly running out of time. Is there a way to detect cannabis in a driver first?
Okay, so that's something that's a very hot topic right now. I do not believe that there's anything that's being employed, but I know that they are looking at it very, very closely, and I do believe that there will be ramifications for using cannabis and driving.
Right. And secondly, we didn't say this in the first segment, but your clinic is not a dispensary.
Correct. So my clinic is not a dispensary. When 5 dispensaries were shut down in London, these were solely dispensaries. There was no physician on board. My clinic is just a family medicine clinic that is focusing on cannabis medicine. So we are just using cannabis in our clinic like we're using any other medicine that's in another physician's clinic. But we are primarily just a family physician's clinic.
Okay. Thanks for coming in again, Dr. Hart.
Thank you so much. I really appreciate it.
Always a pleasure. Very knowledgeable. And if you want information about Ready to Go Clinic, you can go to MikeHartMD.com and